We grew up being told that cranberry juice is good for urinary tract infections. Is that true? What is the role of cranberry tablets? What about just drinking more fluids? Does it help? Welcome back. I'm Dr. Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. Today, we will be discussing a new study that set out to explore how well cranberry juice, cranberry tablets, and simply drinking more fluids could help prevent and manage urinary tract infections, otherwise called UTIs. With antibiotic resistance on the rise, the search for these non-drugged solutions like cranberry products has become more important than ever because we're looking for an alternative to traditional antimicrobial antibiotic treatments. So this study reviewed and compared how effective cranberry juice, cranberry tablets, and drinking more fluids are at preventing UTIs. It used a special method called network meta-analysis, which allows for comparing different treatments, both directly and indirectly, by looking through research databases like PubMed, Cochrane Central, and some others. They searched for studies that were published until September 2023. And the study design included a total of 20 trials with approximately 3,000 participants. 88.8% were females and 11.2% were males. Participants ranged from ages 4 to 87, and majority were obviously females. So what were the types of interventions? Well, first we have cranberry juice. This included various forms such as juices, cocktails, or concentrate. Then we have cranberry tablets, non-liquid cranberry supplements, which include tablets or capsules. Then we have increased fluid intake such as non-cranberry liquids such as water or other non-cranberry juices. Comparisons were made with placebo liquids and no treatment. So what was the placebo liquid? The placebo liquid in a study was designed to mimic cranberry juice in appearance, taste, and consistency, but actually did not contain any ingredients from cranberries. So let's list the outcomes that they looked at. So the primary outcome was actually obvious, the number of UTI episodes. The secondary outcome was UTI symptoms such as dysuria, which is pain on urination, urgency and frequency, and also they looked at antibiotic consumption. So let's look at the results. So first we have cranberry juice. So cranberry juice reduced UTI incidence by 54% compared to no treatment at all. However, when they compared it with placebo fluid, the percentage was 27%, which was still statistically significant. That means that cranberry juice does reduce UTIs. Additionally, cranberry juice reduced antibiotic use by 49% compared to placebo and 59% compared to no treatment. So what happened to cranberry tablets? This analysis has showed that cranberry tablets did help lower the occurrence of UTIs, but results weren't as strong or convincing as those for cranberry juice. So specifically, some reduction in UTIs were observed with cranberry tablets, but evidence was not very solid. And comparing cranberry tablets to a placebo or cranberry juice, the reduction in UTI rates wasn't statistically significant, meaning the difference could have been just due to chance. There were fewer studies focused on cranberry tablets, so there's less reliable data on how well they work compared to other options like cranberry juice. Overall, the evidence was weaker for cranberry tablets. The next parameter was increased fluid intake. So what are the results on that? While increased non-cranberry fluid intake reduced UTI incidence compared to no treatment at all, the reduction was not as substantial as with cranberry juice. There was evidence that increased fluid alone have some benefits in reducing UTI rates, but combining cranberry juice with increased fluid provided better outcomes. The next parameter was symptom reduction. So cranberry juice and cranberry tablets reduced UTI related associated symptoms such as painful urination, urgency, and frequency. So here's the conclusion. The study found moderate evidence supporting the use of cranberry juice for preventing UTIs, particularly in reducing UTI incidence and antibiotic consumption. Meanwhile, increased fluid intake alone does offer some benefit in reducing UTIs, but cranberry juice provides a superior clinical outcomes. Cranberry tablets were less effective with limited high-quality evidence in these studies. The results suggest that cranberry juice could be considered as a preventative measure against UTIs, especially for individuals at high risk or those looking for non-antibiotic alternatives. So, what are the clinical implications? These findings support the use of cranberry juice as a viable alternative, or at least adjunct to antibiotics in managing UTIs, particularly given the growing concerns about antibiotic resistance, as we've discussed earlier. Cranberry juice can reduce the burden on the whole healthcare system, and it just helps in decreasing antibiotic prescription and antibiotic-related infection and problem with fungus, for example. And they would be a great thing for women with recurrent UTIs. There are limitations to this study. First of all, variability. In UTI definitions, outcomes, and measures, there was a little bit of difference between those studies. They were not standardized. Secondly, the evidence for cranberry tablets was low because there were not enough studies covering them and their effectiveness. Thirdly, the analysis had a bias towards female participants with only 11% male, so that limits the generalization to men. And lastly, the study included commercial interests in some cases, such as funding by cranberry manufacturers, potentially influencing the results. Well, at least they're honest in acknowledging that. From my standpoint, I am pro-cranberry juice, but especially was reading this study, but we need to be mindful of a sugar content. Cranberry juice, particularly 100% unsweetened cranberry juice, contains around 7 to 12 grams of natural sugar per cup. However, many commercial cranberry juice products, especially cocktails, they have added sugar to balance out the natural tart taste of cranberry. So, and they may contain 25 to 30 grams of sugar per cup or more, depending on the brand. So it's cocktails and a lot of commercial juices. To get the lowest content, of course, it's the best to just drink 100% cranberry juice with no added sweeteners. Thank you so much for watching. Until next time. Bye-bye. If you enjoyed this video and would like to learn more about the connection between foods that we eat and various skin conditions, then you will love my new book, The Clear Skin Diet, Unlocking the Secret Link Between Food Sensitivities and Skin Health. It is now available on Amazon. In this book, I explore how food sensitivities like gluten, dairy, soy, sugar, eggs, nuts, caffeine, wine, chocolate, shellfish, FODMAPs, and nightshade vegetables could be the hidden cause of the skin conditions such as eczema, psoriasis, rosacea, acne, seborrheic dermatitis, and others. Thank you very much for watching.